Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question in this series of questions from our client Robert. And the question last week was part 3 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from our client Robert, which are excerpts from email counseling and consulting sessions with me. And the question this week is part 4 of my 68-year-old mother is in ICU with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? And that's part 4. So Robert describes his mother's situation as follows in this series of questions. Robert writes, Hi Patrick. The first question that I have today is that the doctor hasn't seen the improvement she would have liked in my mum's mental status. What do you think is going to happen next? The next question is, they are recommending that we delay the tracheostomy 2 or 3 more days to give my mum a chance at mental status improvement before we put her through another procedure. She had a setback 2 days ago whereby they suspected another infection or some issues with her bowels, which manifested as deterioration in blood pressure and an increase in her temperature. But that has since improved in the last 24 hours, so all vital signs are currently stable. Number 3. For the first time, we heard the doctors plant the seed of doubt that if my mum doesn't show some sign of improvement in her mental status in the next 2 or 3 days, the family may want to consider whether we want to proceed with a tracheostomy at all, basically sounding like they were putting the option of withholding or withdrawing treatment on the table. This came as a shock to all of us, because this was the first time we've heard them even hint at that. Though she hasn't woken up, the last MRI and all scans have shown no evidence of any brain injury. So we were surprised that they would put in withdrawal of treatment as an option out there. Next, yesterday evening, briefly, the ICU nurse witnessed, and my brother was present then, what she classified as a purposeful movement. The nurse was in the process of suctioning out fluids from my mum's mouth, and at that time my mum moved her hand towards her mouth in order to try and stop the suctioning. She's exhibited that kind of reaction a couple of weeks ago when in the ICU in Brazil. We saw this as a positive sign and communicated it to the surgeon today, but we're not sure how much to read into it. Right now, our plan is to wait 2 to 3 days, spend as much time in the room with my mum as possible, and attempt to talk to her frequently. The hope is that if there are no other complications with her, she will show some signs of mental status improvement. Regardless if there is improvement or not, we will ask to proceed with a tracheostomy. Then we will be in watch and wait mode, dealing with issues as they come and otherwise just give her time to heal and to hopefully wake up. Any thoughts or feedback on the current status and on the plan for the next several days is much appreciated. Regards from Robert. So here is my response. Hi Robert, with all the information that you have given me in your email, I can tell you that I don't see any correlation between improving your mother's mental status and then performing the tracheostomy or not. If your mother is not ready to be weaned off the ventilator, a tracheostomy is usually improving the chances to come off the ventilator without the need for sedation, such as midazolam or Versed or propofol. Therefore, the statement that her mental status is fragile and therefore causing a delay with a tracheostomy to me is questionable. A critically ill patient's mental status with a breathing tube and after prolonged induced coma is never great and often also difficult to assess, hence the need to either extubate, which is removal of the breathing tube, or to do a tracheostomy. A real or a suspected infection is definitely a reason to delay a tracheostomy, that's for sure. Usually, a critically ill patient's situation is improving once they have a tracheostomy because of no need for sedation and also because the discomfort of the breathing tube in the mouth is gone. A tracheostomy usually doesn't cause any pain. Especially with your statement that your mother's vital signs are stable, now would be the time to perform the tracheostomy. I'm already wondering if they are delaying the tracheostomy to help positioning a withdrawal of treatment once a tracheostomy is done. It's going to be more difficult to withdraw treatment. Therefore, I think doing the tracheostomy sooner than later would help your mother's situation. Your mother doing purposeful movements is very good. Therefore, the sooner a tracheostomy, the better, so she can be taken off sedation and do more of it. ICU teams tend to always be negative, just simply because they can, and also to not put up your hopes in case your mum is trying to improve. If they told you from day one, we're going to fix it, and then they don't, they could be in trouble. I hope that makes sense. I see my role very much at giving people perspective and read between the lines, explain what it all means so that you can be in a position to make informed decisions, have peace of mind, control, power, and influence. I will have a listen to the recording now and get back to you with more thoughts. From what you are telling me, I think your mother is doing okay, given everything that you have shared with me and given the clinical picture and the critical circumstances. All the best from me. So, Robert is writing back to this response. He says, "Hi Patrick, I don't think the doctors are suggesting to hold off the tracheostomy until after we see an improvement in her mental status. The primary motivation for the 2 to 3 day delay is to avoid having to give her sedation for the procedure, and generally speaking to avoid any trauma or change so she has a couple of days to heal and possibly wake up. Because of the infections and other complications post-surgery, she hasn't really had a steady period of 2 to 3 days where her body wasn't dealing with fighting something off. So the theory is that since all core things are stable right now, perhaps give her a chance to wake up. Yesterday evening, when we say the purposeful movement for the first time, it was about 24 hours after she had improved from her last setback. A couple of other notes. The sedative used is propofol. Even before this set of issues started, she has been on Keppra after she had a stroke about 15 months ago. They have taken her off Keppra today because it has caused her a lot of drowsiness in the past, which I'm guessing is common. Her breathing has been very good for the last couple of days. Only minimal support was required from the ventilator. The attending surgeon has said that she would do her best to do the operation herself instead of the resident, since it gives the family comfort, though they believe they have a highly qualified team, many of whom can perform the procedure. Best regards, from Robert." So here is my response. "Hi Robert, thank you for clarifying these points. It's good to know that your mother was on propofol and not on midazolam. Propofol is a short-acting sedative and therefore increases chances of waking up quicker. Keppra certainly dampens neurological functionality as its anti-seizure medication, and hence taking it off to increase your mother's chances to wake up makes perfect sense. Now that I have also had a listen to the recording, it does make sense to wait another 2 to 3 days to see what she's doing and if she can continue doing purposeful movements. Maybe she can escape the tracheostomy even. I like that the surgeon mentioned physical therapy and mobilization, and I believe that needs to be next, either after extubation or after the tracheostomy. If your mum gets extubated, again, extubation is the removal of the breathing tube, there also shouldn't be a need for a PEG feeding tube as well. It's very encouraging to hear that your mother's breathing is on minimal support, and that certainly increases her chances to get extubated. But it's also increasing chances to get off the ventilator if she does end up with a tracheostomy. The other good news is that your mother is off blood pressure medications, inotropes and vasopressors, and that's a sign that the infection seems to get better. The surgeon in the recording seemed to be nice and understanding. I would still like to get a better understanding of what the intensive care team thinks, besides them talking about withdrawal of treatment as a possibility. The intensive care team, from my perspective, would have a much better idea in terms of where your mother is at, in terms of waking up and getting her off the ventilator or doing a tracheostomy. The surgeon sounds to me like she wants to give you control of the situation, which I very much like. Also, with no inotropes or vasopressors supporting the blood pressure, the only form of major life support your mother is on is the ventilation, therefore making it all the more less likely to withdraw treatment because there is not much to withdraw. I hope that makes sense. Therefore, the next steps should really be either your mother wakes up and gets extubated, or she will need a tracheostomy and can wake up and be weaned off the ventilator. Also, time is often the ultimate healer in intensive care, and I know how frustrating it must be for you to watch this situation unfold. But time, patience, and staying positive are often your biggest assets in a situation like this. No matter how much you, your family, or even the ICU team wants to speed up the process of waking up, your mother will do it in her own time. Her body has been through much stress in the last 4 weeks, especially also with flying from Brazil to the United States in the midst of a critical illness. I would not underestimate this at all. I still think that with all the information that you've given me, your mother is doing okay given the current circumstances, and either waking up an extubation or a tracheostomy will be next. I hope all is going well for you and your family, Rob. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly, whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.